It's a pleasure to be here and to present our work that we did as part of the Gravitate Health project that I'm going to talk a little bit about today. And Viola is then going to go a little bit deeper into the methodology that we used when starting to develop the digital health solution. I moved on from University of Oslo, and I'm now somewhere else, but this work has been done when I was still at the University of Oslo. And to say what actually Gravitate Health is about. It's an innovative medicines initiative funded project. It's a public-private partnership. And what we were really aiming to do is to empower and equip the European citizens with health information for active personal health management and adherence to treatment. So the main question that we really asked ourselves at the beginning is how can we apply an open access digital platform with trusted digital health information to transform the way patients access and understand health information, and apply this in personal health for adherence to treatment, risk minimization, and quality of life. So just to demonstrate this, our persona is really Maria, who is a Norwegian elderly lady who struggles with her medication, as she is having more than 15 medications that she needs to take on a daily basis. So the first picture actually shows her medication list that she made herself. And the second is demonstrating how she then needs to read through the product leaflet. So the idea with the Gravitate Health project is to actually focus the electronic product information and connect it to our health records and working with the health education materials. So who are the people behind the Gravitate Health project? There are 40 partners in Europe and the United States of America. We have 11 ecosystems that Viola is going to tell you a little bit more about. It's a big European project with 18.5 million euros, and it's running over 5 years. Now it's the second year running. What is also very, very important is, in addition to having the European start and the global outreach, is also that the project is working with members of the user advisory group. And this user advisory group has been involved in the project really from the beginning. So it helped us really start creating the first MVP. We can see how the steps that the project is taking towards the digital solution. So first of all, everybody contributes. Then it's on this is the co-creation. It's the collaboration where we take the diverse inputs and feedbacks from the user advisory group. We focus on the outcomes. This is then really having the shared vision and goals. And it's a constant iterative progress with small increments and iterations. And now I'm going to give the word to Viola, who's going to then take you deeper into the methodology that we have been working with. So Viola, the floor is yours.
Thank you so much, Eva, for the introduction to the project. Thank you. Have you ever found yourself coordinating a highly complex and diverse stakeholder ecosystem on the project? Maybe it was a project with multiple teams, departments, or even countries involved. Was it a simple and straightforward process, or did you find it challenging to navigate? I ask this question because I believe that many of us experience the complexities of working with a diverse range of stakeholders. And when it comes to matrixed organizations and highly complex ecosystem, it can be challenging to achieve a shared perspective and common priorities. In such scenarios, traditional approaches to problem solving may just not be enough. And this is where human-centered design comes in. From the research phase, where empathy is cultivated through conversations and observations, to the ideation and prototyping phases, where ideas are tested and refined, human-centered design provides us with a set of tools that put people, empathy, and curiosity at the center of the problem-solving process. It also provides a safe space so that all perspectives can be taken into account, and a shared understanding of the problem can inspire more impactful outcomes. Now, human-centered design is not just a methodology, it is also a mindset that recognizes the importance of creativity to unlock the power of ideas that logic alone sometimes cannot reach. The visual on this slide is just a snapshot of the kind of tools and techniques that our members of our consortium used to align around common objectives. If you are curious about some of the examples listed here, I would like to invite you to look at the Maria persona and her journey within the article that we're discussing here. If you can recall working on a problem similar to ours, perhaps, that seemed too big, too abstract, or too ambiguous, or impossible to solve, what was your experience like? Perhaps you were given a deadline and the pressure was just mounting, but the solution wouldn't just come to you. One of the greatest minds in history had an approach that could help. He said, if I had an hour to solve a problem, I'd spend 55 minutes thinking about a problem and 5 minutes thinking about the solutions. What Einstein was trying to say is very similar to what has been highlighted here in this double diamond human-centered design process, which became a blueprint to our project work. It emphasizes the importance of clearly articulating the problem before jumping to solutions. It holds us in the problem space. This double diamond process is based on two fundamental questions. The first one is how to solve the right problem and how to solve the problem right. And this is the first step to ensure that we are addressing the right opportunities in a way that meet the needs of all stakeholders. So let's dive in a little bit deeper. Our exploration started with the framing and planning phase. To help us understand specific patient needs, priorities, and preferences, we conducted a series of interviews with patients across multiple healthcare ecosystems. We used Delphi's study methodology to identify the most important needs and matrix to support patients' outcomes and opportunities throughout the healthcare systems. We then used prioritization surveys to gather a broad spectrum of requirements, ensuring that the project addresses the diverse needs of patients in a focused way. And through this research, we developed critical success factors and KPIs and established like a guide almost, or a North Star, to the incremental design and development of the project, while also ensuring that compliance is met with the healthcare standards and regulators. Once we reached a consensus on patient needs, priorities, and requirements, we initiated the process of assessing, integrating, and evaluating the functionality of our solution. And to ensure the usability and adoption of the platform was met, we actively engaged a dynamic, growing community of patients and healthcare professionals through the user advisory group that Eva has mentioned before, including collaborations with various stakeholders across 11 global ecosystems. In this process, we learned that individuals are more likely to back initiatives that they contributed to creating. When people are directly involved in creating something, they feel a sense of ownership and develop emotional connection to the work. It makes them more invested in its success and more likely to support it. It becomes personal and people start to care about the outcomes. The sense of accomplishment that comes from being part of the project is a very powerful motivator. Our co-creation efforts not only allowed us to gain valuable insights and feedback, but also allowed us to continuously refine our design and also clarify our requirements even further. Definitions of user experience and platform architecture have been captured in technical requirements, and the evaluations are currently taking place in more than 8 countries using evaluation by design methodology with a focus on cross-regional reference and interoperability. Currently, we are designing the UX mockups in 2-week sprints, working with the user advisory group monthly during our design workshops. And as with all the design and development activities, we are also actively reaching out to other partners, startups, and organizations to take part in co-development activities using global connectathons as a platform, also interoperability showcases, as well as the upcoming hackathon to advance the platform's functionality and also increase potential for sustainable impact on our outputs. As we progress the development of the early implementation, as Eva mentioned MVP, we recognize that success is not just about the result, it's also about the journey. And it's just not enough to simply develop a product and hope that it will be adopted. We fully intend to take intentional steps to evolve and expand our ecosystems and generate visibility and engagement amongst all our stakeholders across all those diverse ecosystems, and to drive targeted efforts that will ensure the sustainable impact of our project. Thank you for listening.